Virtual Reality in Nursing Education by Tabitha Armbruster. Introduction to Immersive Virtual Reality in Nursing Education. In this ever-changing world of medicine, one must constantly learn to attain and maintain the latest information that fosters competency and skills in nursing. Everyone learns and retains information in different ways. Some students are visual learners, some students are auditory learners, and some people are interactive learners. In a society that is dominated by technology, implementation of gaming and virtual reality could elevate learning experiences in nursing education. Use of immersive gaming is on the rise in the medical world. Immersive gaming involves high-quality computer graphics that make players feel like they are a part of the game. Virtual reality is a form of immersive gaming that involves computer simulations of realistic three-dimensional environments in which one feels that they are actually present in. This involves wearing a headset and using hand controls that allow the players to move around inside the virtual environment. These innovative tools can be used to improve learning outcomes in many ways. Literature. Several studies have indicated that virtual simulations of clinical settings have bridged the gap from nursing education to professional readiness. A recent study found that 55% of new nurses have made medical errors as a result of inexperience in rushing. Nearly 32.8% of registered nurses left their job within the first year due to pressures of practice without the skills to recover and build resilience. Immersive virtual reality simulations have proven to be an effective tool in preparing nursing students for real-world clinical situations. Studies have shown that the use of different virtual reality simulations results in improvement in clinical skills and clinical reasoning, which is the process of assessing, identifying problems, intervention, and evaluation. Application of virtual reality in scenarios involving patient decline or emergent events have resulted in better outcomes than traditional application of knowledge in a clinical setting. However, it's debatable as to whether immersive virtual reality is capable of replacing traditional teaching methods rather than supplementing them. Capabilities of virtual reality in nursing education. Implementation of virtual reality in nursing education can increase student motivation and participation with its vivid graphics and fun way of engaging the learners. Virtual reality can improve skills proficiency, decision-making skills, and elevate nurse confidence. Many different clinical scenarios can be practiced repeatedly, reinforcing knowledge and experience. Virtual reality can also offer real-time feedback during and after scenarios. This allows for the student to reflect, which is important to the development of clinical reasoning skills. Virtual reality can be personalized to provide learning that meets the individual needs of each student. It can also free up teaching time for instructors in that it is self-directed learning and multiple students can participate at once. This new technology may even be beneficial to improving the nursing shortage. Virtual reality can be used remotely, making it easier to create online nursing programs that include hands-on skills practice hours. Implications for nursing education. Virtual reality can be used in many aspects of nursing education. Students can practice clinical skills such as IV insertion, Foley catheters, medication and blood administration, wound care, intubation, and other hands-on skills. It is used to develop critical thinking with various interactive patient scenarios that involve assessment, intervention, and evaluation. It is used to enhance practical skills such as time management, adaptability to different situations, and enhance technological skills. Virtual reality can be used to supplement or replace traditional in-person clinicals when there are clinical scheduling limitations and/or limited clinical sites. Virtual reality simulations offer practice and repetition in various areas of nursing, enhancing overall job efficiency. Advantages of virtual reality in nursing education. As previously discussed, there are many advantages of incorporating virtual reality simulations in nursing education. Virtual reality simulations provide real-life environments and scenarios that the nurses can practice in without the outside pressures of the real world. They can practice these different scenarios repeatedly without the risks of harming patients if errors are made. Without added external pressure, it is easier to retain and focus on the information that is meant to be learned. Repeated scenarios can facilitate better knowledge and skill retention. Virtual simulations can be created to personalize individual learning experiences but also make learning outcomes uniform among all nursing students. Each student may experience different events during their traditional clinical rotations, leaving inconsistent training experience among nursing groups. Virtual reality requires engagement from each student. Some students have reported that it adds fun to the learning process. Practicing in a fun, stress-free environment can foster the use of team structures as well. Speaking from experience, traditional clinical experiences are limited. Traditional clinicals are only scheduled once or twice a week for most nursing schools. Nursing students don't usually get to participate in codes or emergencies during clinical rotations due to lack of experience and safety of the patient. These are events that definitely need repetitive hands-on practice to master. Virtual reality can offer flexibility of time and place for practicing required skills that traditional clinicals can't always offer. Varied experiences are more accessible with virtual reality than they may be in traditional clinical settings as well. Disadvantages of virtual reality in nursing education. One of the biggest disadvantages of virtual reality programs is that they are very expensive to create and maintain. High-speed computers and specialized accessories are required to operate virtual reality programs. Users of virtual reality need to be trained to use this technology efficiently. Virtual reality programs need to be constructed to meet the requirements of different nursing specialties. Another disadvantage is that virtual reality programs reduce face-to-face communication with real patients, which reduces personability in healthcare environments. User attitudes towards such a new, unfamiliar technology is also a barrier to its use. It is important that these programs are user-friendly or they'll be rejected by consumers. Virtual reality simulations can cause physical side effects called cyber sickness, which includes dizziness, nausea, vomiting, headaches, and eye strain. Lastly, there are not enough research trials on the effectiveness of virtual reality in nursing education to fully assess whether the advantages outweigh the disadvantages of implementing it. Ensuring buy-in. In order to ensure consumer purchase of virtual reality programs, one must address the needs of the target audience. In this case, the nursing education system needs to help nurses become more proficient and efficient upon entering the nursing workforce. Emphasis on ways virtual reality can help attain that goal is important. Discussing advantages for institutions in adopting this new technology is key. Studies indicating improvements in student performance after using virtual reality products are necessary. If students are performing at a higher level right out of school, nursing schools get higher reviews. Utilization of consumer reviews of virtual reality programs are necessary as well. Virtual reality products need to be altered and improved based on these consumer critiques to build brand trust also. Anticipated challenges. One of the biggest challenges is the lack of research evidence indicating the advantages of virtual reality in nursing education. Other big challenges are the novelty and cost of virtual reality in the classroom. More statistical research is needed for the widespread adoption of this new technology. Research on effectiveness and ways to make the programs specialized and easy to use are necessary. Making the product worth the cost is essential to incorporation of this new teaching tool. Reminding consumers of the increasing use of technology in our world is important. Times are changing. Ways of teaching and learning are changing. In conclusion, despite the disadvantages, virtual reality has the potential to transform nursing education and enhance learning experiences and proficiency in the workforce.